So I'm a family doctor, and that's actually about half of my job. So my other half of my job is I'm an academic family physician as well. So I work for the university and do a lot of teaching. So that's sort of half of my job is teaching and doing things like teaching courses at the university. And then the other half is seeing patients, my own patients, at this family medicine clinic. I've got at least a medical student and a resident with me every day, and we see patients in the morning. Typical family medicine patients are everything. So we see chronic illness, we see patients for prevention, for screening, counseling, following up on an illness that they've had that we've been wanting to see how they're doing. I'll work with nurses, nurse practitioners, clinical assistants, and my residents and students see my patients with me, and sometimes they see them while I'm seeing somebody else. And then there's usually lunch, which I sometimes get and I sometimes don't get. And then the afternoon is a similar thing, so I'll have patients booked in the afternoon with residents and students. I would say it's the relationships that I get to work with people every day, and I get to meet new people every day, but I also get to see, you know, those patients who I've seen for over 10 years now, to see them through their lives and their kids, and be able to provide the care. It's such a privilege to be able to be such an important part of the medical community, I guess. So another thing I really like is the flexibility of the job, and a lot of family docs can sort of, they want to do comprehensive care and they want to take care of their patients, but they can work in a hospital if they want to, and they can deliver their patients' babies, and they can take care of their patients when they're really sick, and they can, you know, take care of them when they're dying, and or they can do counseling. And so there's a lot of different parts of it that make it kind of fun every day, and every day is different.
Yeah.
I didn't know anyone who was a doctor, and I think that was odd that I didn't know that, and I didn't have a sense of what it was before I came in. I had no clue what being a family doctor was. I think I had a very skewed idea of what family medicine was, and I certainly wouldn't have picked it as my choice coming in. Like even coming into medical school, I thought the only doctor that I had worked with was a cardiovascular thoracic surgeon, so of course I wanted to be a cardiovascular thoracic surgeon. And I think that would have been an amazing job, but it wouldn't have been the right job for me. Mental illness, people often think that it's all in your head, and it's not, and they don't realize how common it is, so they don't share. And that's I think that's a big problem. So at least 20% of people, all people, will experience mental illness themselves, have something in their lifetime. Significant. Like, and it's a medical condition. It's not you just feeling sad. It's not a person just not being able to cope because they're not strong enough. Yeah, that's what people think, and that's what people's husbands and wives think, and that's what people's parents think. And so they'll come in saying, you know, that they've got something wrong with them, but it's all in their head, and why can't they just get over it? And it's not all in their head. It's a medical condition. It's a biochemical problem. It's a chemistry problem. And I think that puts barriers up, because then people don't seek treatment because they think, well, I should be able to handle this. Well, people that have thyroid problems, that's also a hormone. Mood hormones are hormones. So thyroid, people should be able to get over that then too, right?
Yeah.
But that's okay to have, and yet depression, anxiety, panic attacks, bipolar illness, that's not okay. So that's a big one, and it's hard for me because I see obviously so many patients that have it, because it's such a big part of family practice, and yet they're so reluctant to seek the appropriate treatment, which sometimes can just be counseling. Counseling can have a big impact on people. They need to learn as much as possible about their own bodies, about the ways that they can protect themselves and be, you know, the most healthy.